Greater Baltimore Neurosurgical Associates is committed to relieving their patients' pain and anxiety. Joining me now with more on minimally invasive surgeries and what it can all treat is Dr. Justin Slavin. Welcome.
Good morning.
I'm happy to have you here. I'm hearing more and more about minimally invasive surgeries, or at least hearing that term, becoming more familiar with it. But I feel like I'm like a lot of people where we really don't know what that is. Can you explain it to us?
Absolutely. So I'm a neurosurgeon at GBMC. Specializing in spine surgery specifically. Now, spine surgery, it's an important thing for a lot of people who experience pain and trying to relieve that pain. But the spine is an interesting part of your body in that it's a very protected part of your body. You have to go through a lot of normal tissue in order to treat certain spinal conditions. Minimally invasive spine surgery is aimed at treating those same problems using similar techniques that cause less disruption to your body and hopefully improve and speed up the healing process.
So you said improve and speed up the healing process. What about the pain? Is it less painful than other techniques that would be used in the past?
Well, when we're talking about postoperative pain, minimally invasive surgery doesn't eliminate pain from the procedure. You're still changing things in your spine. You're still making incisions in the body. What it is aimed at is speeding up the healing process to make that pain resolution from the surgery faster.
Right.
When you disrupt fewer tissues, even though you still have that initial pain, hopefully the pain is much improved within the first few days.
So whereas a previous surgery, it might be what's the time frame for healing as opposed to minimally invasive? And I know it differs from person to person.
It varies from person to person. But in terms of just the incisional pain, usually people are feeling much better within the first few days. Whereas in open surgery, you have to recover not just from the incisional pain, but from mobilization of the muscles around the spine. That can be a week or more before you're really ready to feel anywhere close to normal.
So who is a good candidate for minimally invasive surgery?
Well, there's a lot of considerations that we have to take into account. Theoretically, everyone can be approached from a perspective of why can this person not have a minimally invasive procedure? Certain anatomical considerations, variances between the average person's body may make a difference whether they're a good candidate for surgery. Sometimes the severity of the disease process eliminates minimally invasive surgery as an option just because it requires too much work to do through small openings.
So the best candidates would be whom?
The people, in addition to just making sure that they meet all the criteria for having the appropriate anatomy and the pathology, I do think it's a particularly advantageous technique for people who are higher medical risk, who may not be able to tolerate a bigger surgery and undergo risks of blood loss, risks of infection, risks of wound healing, people who have heart disease, people who have diabetes or other wound healing risks. So
if someone is experiencing pain and they really don't know how to go about relieving that, what are the steps that they take when they come to you? Do they just call the hospital, go to the website? How does it work?
Certainly. Well, there's a lot of different ways people start this process. A lot of people will start by talking with their primary care doctor. That's oftentimes a great entry point into the healthcare system and trying to figure out who does this person need to see and what is potentially the different problems that could be causing the pain. Once they see a spine surgeon, believing that the spine to be the source of their pain, we obtain appropriate imaging to better determine what specifically is causing this pain and develop treatment strategies that will alleviate the pain. Some of those can be medical, taking medications. They can be procedure-based, doing injections or therapy, and sometimes it does require surgery in order to treat things adequately.
Got it, but you sort of work your way up and try other factors. So we've got the information on the screen there. Just go to gbmc.org for more information. And thank you so much for being here. Really appreciate it.
Thank you.
We'll be right back with more Midday Maryland right after this. Stay tuned.